Good day, I am Nicole Mojico from BSN 1B, and today I am going to perform the assessment of the male genitalia and the rectum. So first is to gather the necessary equipments, the stool, the pen light, the gloves, and the gown. And then next po is to explain the procedure to the client and ask the client to put on a gown. So, assuming po na yung client is ready for the assessment, so I will be putting on the gloves na po. Okay. So, now I will proceed for the procedure. So, first po is the penis. So, inspect po the base of the penis and the pubic hair for growth pattern and excoriation, and also the presence of erythema and infestation. And then next po, I will be inspecting the skin of the shaft for presence of rashes, lumps, or lesions. And the next po, I will be palpating the shaft. I will be palpating the shaft for its hardened areas or for the areas of tenderness. The next po, I will be inspecting the foreskin if present po. So, I will note for its location, for its color, and the integrity. And the next po, I will be inspecting the glands. So, I will be inspecting the glands for its size, shape, and then also for presence of lesions or rashes. And I will note also the location of the urinary hiatus. So, if uncircumcised po si client, you can ask him to retract the foreskin, or kung sabihin man po na hindi kaya, is the nurse will be the one to retract the skin po. Okay? So, next po is to palpate po the palpate for urethral discharge by squeezing po between index finger and the thumb yung glands. Okay. So, next to the penis po is the scrotum. So, here po, you can ask the client na hawakan po yung kanyang penis and itaas po so that we can accurately inspect and observe the scrotum. So, inspect the scrotum po for its size, shape, and position. And the next po is to inspect also or inspect also for presence of lumps, bulges, or swelling. And then next po is to inspect po the skin of the scrotum for color, integrity, presence of lesions or rashes. So, here po, you can, meron pong tinatawag na scrotal folds po. So, kailangan po itong ma-spread, and also para ma-inspect po yung posterior skin po ng scrotum, which is yung nandito po sa likod. So, we will be lifting the sac po para ma-inspect po yung posterior skin. And then, next po is to palpate the scrotal contents, the epididymis and the testes. So, using po my first two fingers and the thumb. So, ganyan po. Okay. So, note po for its size, shape, consistency, tenderness, and presence of nodules or hardness. So, next naman po is we'll palpate also the vas deferens and the spermatic cord, and note the swelling, the nodules or tenderness. And then, next po, After palpating po, so I will now trans-illuminate naman po yung scrotal contents. Kung meron pong swelling na na-notice po. So, and I will look for a red glow. Dito po gagamit ng pen light sa pag-trans-illuminate. Then, next po sa scrotum is the inguinal area. So, first po is to inspect the inguinal and the femoral area. So, I will watch for bulges po while the client bears down. And then, next po is I will be palpating the inguinal area po. So, here po, I will ask the client po to shift weight on the left po para ma-palpate ko po yung right inguinal canal. So, my index finger po, ipapalpate ko po yung sa right scrotum, and then I will press upward po hanggang po sa slit opening nung external inguinal canal. So, there po, I will ask the client to bear down or cough, and then uulitin ko naman po siya sa left side. And then next po is I will be palpating naman po the femoral hernia. So, in palpating po the femoral hernia, nandun po siya sa front ng thigh on the femoral canal area. So, I will sa pagpalpate po ng femoral hernia, I will ask the client din po to bear down or cough, and then watch for bulges po, and then after po that, we'll repeat naman po on the other side. And then next po is to inspect and palpate the scrotal hernia. So, in this one po, I will ask the client to lie down and then watch po for the bulge. So, kung hindi po mag-disappear, so, ang gagawin po is to auscultate it for vowel sound, and then ipupush po yung mass up on the abdomen kung hindi po siya too tender. And then, next naman po sa inguinal area will be the anus and perianal area. So, same lang po doon sa female genitalia and rectum. So, first po, I will be inspecting for lumps, ulcers, redness or rashes on the anus. And then po, I will inspect the sacrococcygeal area for the presence of hair in pilonidal area, for swelling, tenderness. So, next naman po is I will be inspecting for rectal prolapse with Valsalva maneuver. So, the client will bear down and then take a deep breath and then push his breath po. And then next naman po is I will be after po the inspecting for rectal prolapse is I will be palpating the anal sphincter. So, using my finger pad, I will place it on the anal sphincter, and then with slight pressure po, and then kapag nag-relax na po si sphincter is I can insert na po gently my index finger. So, here po, para ma-determine po yung tone ng sphincter, so I will ask the client to tighten his external sphincter. And then, para po palpate for tenderness and nodules, I will be rotating po and palpating on the sphincter po. And then, next po is the rectum naman po. So, here po, As much as possible, i-insert ko po ang index finger ko sa rectum. Okay? And then, I will palpate the rectal mucosa for irregularities, nodules, tenderness. And then, I will also palpate the peritoneal cavity for rectal shelf, the tenderness, and the nodules. So, ang pagpalpate ko po sa kanila is mag-rotate po ng clockwise and counterclockwise. Okay? Next po is to palpate the prostate gland, which is dapat po mag-rotate ka po ng counterclockwise para po yung finger pad po is nasa parang harap po ng umbilicus, nakaharap sa umbilicus. And then, ipapalpate po yung prostate gland for tenderness, texture, shape. Okay? And after that po, aalisin ko na po ang aking index finger and I will observe the feces for blood and perform occult blood test. And then, for the analysis of data, I will be formulating the nursing diagnosis, the health promotion, risk and actual. Also, I will be formulating collaborative problems and also to make necessary referrals.